Good afternoon, everybody. Thank you for joining us today for the March 2024 Family Advisory Council. I appreciate everybody's time and everybody being here today and all of our leadership. I'm looking forward to some great conversation with all of our folks today and speaking with everybody. So as you will see, we do have captions in Zoom. So if you can click on the captions icon. Alternatively, you may find a link in the chat to open captions in a separate window. And we have our ASL interpreters who will be spotlighted throughout the meeting. So as a reminder, please remain muted when you are not speaking. We encourage you to use your video feature, and today's session is being recorded. Another reminder, please note that by attending this event today, you are giving permission for your image and your voice to be used. This recording will be uploaded to the DODD website at a later date. This meeting is intended for DODD administrative team to hear firsthand from multiple people on focused issues that affect people across the state of Ohio, and allows opportunity for everyone and a chance to share. So if there is an issue or a concern that is specific, please send us an email or connect with us, and we'll be happy to address your concerns at a later time. So moving right along to our agenda, we'll be hearing about direct support professionals and some updates in that space. Our community life engagement team will give some updates. Medicaid, we'll hear some updates there. The Ohio ISP team and the Ohio LifeCourse Nexus team will be sharing some updates as well. And to wrap up our time, we'll have our leadership sharing and connecting with everybody. So first up, I'm going to pass things over to Ann Wysant to share about direct support professionals.
Thank you, Meredith. Good morning, everyone. My name, as Meredith said, is Ann Wysant. I am the direct support professional and provider support manager for DODD. Myself and my team, we cover all 6 regions of Ohio in an effort to work with local county board provider support staff, county boards, providers, and direct support professionals on issues that are important to them. And that can include a multitude of issues, including assisting them with questions around certification, questions around upcoming compliance, connecting them with appropriate subject matter experts from the department to assist them with those things, as well as just providing general support to them. We've been focusing a lot recently, obviously, on workforce. So we kind of segued our efforts from focusing a lot on COVID over the last 3.5, 4 years to focusing on a lot of workforce related issues. We also provide crisis support. So last week, we were pretty engaged with our county boards and providers after the recent tornadoes, just to ensure that everyone had what they needed to continue to support the individuals that they are working with. So I just wanted to give a quick update regarding some of the workforce issues and efforts that the department is working on. We certainly recognize that workforce issues are not specific to provider agencies. They're not specific to county boards and teams. They are specific to the individuals who are receiving supports and their families. Because obviously having access to a direct support professional and someone to meet those identified needs of your family member is so very important. And so ensuring that you know what efforts we are taking and what activities are going on statewide are very important. So the first thing I wanted to share with you was just a little bit of information regarding our recent ARPA project. ARPA is the American Rescue Plan Act. And through that act, the state of Ohio was allocated funds to help with a number of projects. One of the projects that DODD has chosen to utilize our allocation for is around DSP and workforce support. On February 1st, we opened a request for application, which was available for agency providers, county boards, other organizations that support the work of home and community-based waiver providers to apply. They had 7 areas under the project that they could submit proposals for. Those areas all centered around, again, supporting our current workforce, as well as looking for innovative ways to enhance recruitment efforts around the state. And so those 6 areas included the development of DSP professional networks, so ways that we could enhance the professional skills and credentials and training that are offered to direct support professionals around the state. DSP personal networks. These are ways in which DSPs can be supported with non-traditional, non-work related needs. For instance, we heard a lot from direct support professionals that things like childcare, things like transportation, were sometimes things that were barriers to employment or continued employment. Additionally, there were projects around supporting frontline supervisors and directors of operations in enhancing their skills or developing potential career paths within an organization for DSPs to move into frontline supervisory positions, for frontline supervisors to increase their skills and maybe move into other leadership positions. So again, focusing on training and mentorship for frontline supervisors and directors of operations. Developing a DSP-centered organizational culture. Again, as we spoke to direct support professionals around the state, we found that they often were concerned that they didn't feel supported by their organization, that they didn't feel like there was a culture of respect and support. So that was one of the areas that we agreed to provide funding. Building relationships. Again, projects that look at ways that relationship building between the DSP, their employer, the DSP and the people that they support, the DSP and families, and ways that building those relationships could again enhance the experience of the DSP to help increase retention, longevity, and just better working relationships for everyone involved in the service delivery system. Awareness campaigns, again, providing funding to help the field learn more or help the field share with others more about our field, more about the DSP career path. And again, just to enhance not only awareness of what the DD system is, but also potential recruitment efforts. And then finally, we had kind of a catch-all in other category. And we were very excited to see that we got proposals that were things that were outside the box, things that we had not necessarily thought about. So we're happy to say that we were able to award the entire $5 million. That money was awarded to 44 separate projects. Some of those projects are offered by the same organization or the same entity. I believe out of the 44 projects, I think we had 36 separate entities that were funded to put on or to work through those projects. The best thing that will come out of this is that at the end of the program period, the project period, which runs through December 31st of this year, we will be engaging all of those participants in a workforce symposium. The intent of the symposium is to help others hear about the successes and some of the challenges that these applicants encountered as they were implementing their projects. And the hope is that two things will come out of that. That number one, there will be lessons learned that can be shared with other agencies, other organizations that weren't participating in the project. And then also that there will be successes that can be sustained. And there will be ways that these other agencies and organizations will be able to sustain these efforts past the project period, again, in order to see a increase in the number of DSPs entering the field through recruitment efforts, and the number of DSPs maintaining employment in the field through the ongoing retention efforts. So we're super excited about this and super excited about the impact it will potentially have on individuals supported and families as we develop a larger provider pool, a more educated and more sustained provider pool that will be here hopefully long-term. We are hoping to see increases in recruitment rates and decreases in staff turnover rates. So again, super excited about that project. The other thing that I wanted to share with you just quickly, and I'm sure there are others probably today who will have more detailed information, but as many of you know, there was a waiver rate increase that went into effect on January 1st. And one of the things that our team has been doing is we've been engaging with providers and provider organizations just to get feedback on how those rate increases have affected retention efforts and recruitment efforts. And we are pleased to say that we're hearing lots of great feedback from the field, that the intent of the rate increases, which was to help increase the average wage of direct support professionals, is resulting in the reporting of increased applications in the field. We have had the reports of providers who have seen a 60% or more increase in the number of applications since January 1st. We are also hearing from our provider organizations that they are seeing a decrease in applicants who are not following through. So the term ghosting, someone who is offered a position or offered an interview and then they just don't show up. So they're seeing a decrease in that. And they're also seeing an increase in the number of direct support professionals who are completing their onboarding training and then actually moving into a direct support position where they are implementing and providing services. So again, very excited about the impact that has had on recruitment and retention efforts with our direct support professionals. And then finally, just letting you all know as family members about some of the available training we have for direct support professionals. Many times, especially with independent providers, it's difficult for us at the department to get communication down to that level. But your direct support professionals, folks who are supporting you, are having regular contact with you. So anytime that you can help us in spreading the word, that we offer a free training series that is focused on direct support professionals, sharing information that is not only important to them, but is being shared in a manner that is consistent. I'm sorry, I'm not sure if I got kicked out or what happened. I apologize for that. But not only is it shared because it's important to direct support professionals, but we're also presenting it so that it is consistent with their experience. So we would love to have you share that with any of the DSPs that are working with your families. The session is held the fourth Monday of every month. from 10 a.m. to 11 a.m. And they can register on the DODD website under the events section. And then finally, while he's here, I do want to introduce my partner. He is part of our direct support professional and provider support team, and that's Michael Hogan.
Hi, everybody.
All right, so that is kind of the update from our team. We appreciate the time to share with you some of the things that we're working on, and wish you a good day. Thank you.
And it sounds like you guys have been so busy on your team. And Michael, thank you so much for joining us. So many wonderful things and activities. Does anybody have any questions? I have an extra pair of eyes checking for questions or hands up or anything like that. No questions. Okay. Well, thank you so much for all of the information. At the end of this meeting, we will be sharing links and emails for our folks who have shared. So, and I appreciate your time. Michael, thank you so much for joining.
Thanks for having us, Meredith. And I did put the email address in the chat. And Corey, thank you so much. Corey also put a link in the chat to our page on our website that gives more information about the ARPA Workforce Support Project, as well as many other ARPA funded projects that the department has going on right now. So thank you again for the time.
For sure. I'm excited about all of the things that are happening and all the ways to see how folks in our system are going to be supported. So as you can see, I am no longer sharing my screen, but I'm going to pass this along to Keith Banner, who is our community life engagement specialist or manager, I should say. And we're going to go ahead and let you share your screen, Keith.
And is it coming through okay?
Yes, sir.
Okay. Hi, everybody. I'm Keith Banner with the Community Life Engagement team. I'm going to get to, there we go. Thanks for letting me be on just to walk you through some of the projects and initiatives that our team is working on. I wanted to highlight this series, A Day in the Life, the 2024 Innovation Series, which is basically a series of virtual webinar meetings throughout April and May that ends with an in-person summit on May 29th. And basically, we I was going to maybe take you to the website for this one real quick. I hope I can do a new share and it'll let me. Let me see. Hold on a sec, because there's some good information I wanted to make sure you guys get. I'll escape this if it lets me. I'm stopping the share so I can go back into the screen here. Hold on a sec. I had it all set up and then of course it's not there.
It's okay. Technology is a lovely thing when it works the way we want it to, right?
I know, isn't it? But it's not when it doesn't. Haha, here it is. Now I can share this, I hope. Yes, I'm going to share the website. This is our Employment First website. And I wanted to walk you through the actual website that talks you through the innovation series for 2024. This is our 5th one, I think. Been doing them for a while and they kind of evolve every year. And this one's going to be probably one of the best ones we've done. I know it will be. And you can see here in the, it starts April the 3rd, and we have a series of webinars that kind of are talking about what innovation means in different spaces with different kinds of folks. So April 3rd, we're going to talk about maximizing resources. April 10th, community connections. And if you click on the links, you'll get an explanation of what those titles mean. And those virtual trainings go all the way through May 22nd. And then we have an in-person summit 9 to 4 that kind of brings together all the information we talked about on the virtual series. And basically we get together with breakout sessions and have a lovely day talking about integrated supports, person-centered outcomes, community building, relationships, and employment opportunities. this is not just the community life engagement team that's pulling this together. This is the quality and innovation team that Corey and Meredith and Ann and Beth, who's going to be on, are all a part of. So we're pulling together the whole division to kind of make sure this is a success. So in the chat, or not in the chat, but in the slides that I'm going to show you again, you can see, you'll have the link to that website I took you to, and please register for anything that interests you. And we're looking forward to that. Now I'm going to move into the next slide. We have a coming soon on this one. We've been working with a couple of organizations to kind of add to the community life guide that's on the Employment First website. We're doing modules specific to people with lived experience and their families around financial and digital literacy, and moving from childhood to adult health care. So these are trainings that have been really developed through a lot of advisory groups, a lot of really great homework. And we're going to be really proud to be able to walk you through the actual modules at some in-person trainings. A couple are happening in Columbus. And when you get the slide deck, you can click on those links here to see where they are and when you can register if you're interested. Then also we have a series of virtual trainings for families and professionals and people with lived experience to walk you through the financial and digital training, literacy modules, and the moving to adult healthcare training. So we're excited about being able to offer that. I wanted to give you an update about the Adult Day Support Quality Pilot Project we began in 2023. We're working with 100 adult day support providers to kind of bring up the quality of that support through an investment in technology for organizations. And also we're helping providers with funding to hire or contract out a quality staffing position or positions, depending on the size of the provider, to kind of focus in on a set of quality measures we established around supporting people who have more complex needs around community-based services. And basically we're working with them through June 2025 with this project. And you can click here on this link when you have the slide deck to see some stories about what's happening. We're really getting some good results from these providers that are kind of connecting to what does quality in this adult day support world mean, and how do we kind of capture that by focusing in on it and helping the people we support have a better lives through that service. And then we also are partnering with Opportunities for Ohioans with Disability on a 5-year federal grant called Works for Me, which is supporting people who are in subminimum wage or contemplating working in a subminimum wage facility, if they're interested, to kind of look at how we can help them look toward community integrated employment. And Melissa Morelli is the DODD person that's in charge of here. And I put a link in here to a great story that we just stood up about some of the providers that are getting on board. We're also supporting our employment services providers with some funding to build their capacity in the same way that we're investing in the adult day support providers toward a waiver amendment that's hopefully going to happen July 1 that will incentivize employment services around job development, getting a job with a good wage and good hours, and keeping a job that you want for certain periods of time. And the provider will be able to get outcome-based payments on those goals. So we're hoping that the funding we're standing up for employment services providers to pay for training, pay for technology that'll assist their job coaches, pay for the staff time to go to training and get credentials, all that will support capacity building toward being able to be a better provider and be focused on those outcomes. Then all these grant projects that we're working on, I could read through all these to you, but I won't. But I wanted to focus in on a couple of them. The regional tech hubs are really exciting, and they're in all parts of Ohio. We have 8 of them that are sprouting up, and each of them have a different focus. But as you'll see, they're all through county boards, through council of governments, through providers. They're establishing regional technology training and experience centers, basically for folks to come in and kind of see what's happening around supportive tech, remote supports and assistive tech, and kind of being able to kind of try it out. Lending libraries are a part of this, and some of them get training from experts. So a wide variety of different approaches for each of the regions. And these are, like I said, in 8 regions all across the state. And then also, I wanted to point out that we're getting ready to award a transformative technology solutions grant to several awardees around health-related and provider-related technology to kind of transform the way that people with lived experience and their families experience the service system and the health-related service system. So that'll be coming up soon, so be on the lookout for that. And then I also wanted to point out that we also sponsor an internet assistance project through the county boards that allows people who are eligible for DD services who need access to the internet to get reimbursed through the county boards, and we'll reimburse the county boards for that funding. And so there's a link there for more information about that. And then for all things around supportive tech, there's a monthly tech update that you're welcome to subscribe to, so you'll keep up on all the latest things that are happening around supportive tech. And again, when you get this slide deck, you can check in and send me an email, or if you have other questions, but I think I am through, and I'll stop sharing.
Wow, that's amazing. I am so excited to hear about all the things that you guys are doing and how folks are going to be supported throughout the state, Keith.
It wears me out a little, Meredith, to even go through it. So yes, thank you.
You did a fabulous job coordinating it all and getting it all together and sharing it. Does anybody have any questions for Keith about his team, about the work that's happening, about how things are going to develop over the next year or so? I'm scrolling through. I don't see anything in the chat.
And like I said, anybody's welcome to always email me, or and if you have questions or concerns about anything that I mentioned. So thanks, Meredith.
Thank you. And thank you for sharing your PowerPoint. I'm sure everybody will be excited to go through all of the information that you've shared with us. So I appreciate it. And thank you for your time today. So I will go ahead and share my screen again and announce our next speaker. So we will be discussing the updates in the Medicaid space. We have a few speakers in that area. So we have Jillian Carlson and Naomi Cradle who will be sharing. So if one of you ladies would like to begin.
Great. Thank you, Meredith. My name is Jolyn Carlson, and I am a policy manager in the Medicaid Development and Administration Department. In addition to working specifically on the home and community-based service waivers, I supervise a small technical assistance team that provides support to county boards, providers, and families on all things policy related as it relates to the waiver. I want to just give a couple updates since this group met last about some changes that took place in January and some things that will be taking place in July. So in January of 2024, we had 3 waiver amendments, amendments to the level 1, the self, and the IO waiver, and that included a number of rate increases for various home and community-based services. And in addition, in that amendment, also there are rate increases that happened January of 24 and July of 24. And in addition to that, the budget limits for the IO waiver DDP funding ranges, the limits for the level 1 and self waiver were increased in January, and those increases accommodated the additional July rate increases. So I know there's been a lot of talk on rate increases, but wanted to mention that. Some of the other major changes that started in January were some of our post Appendix K items. And there were some changes to residential respite and shared living. Residential respite and shared living are now permitted to happen on the same day. And that's in the, oh my goodness, the inception of the residential respite 15-minute unit is what is available only for folks who have shared living. Some other changes to residential respite are that the daily rate and the 15-minute unit rate can now be provided both in and out of a person's home, as well as also in the provider's home. Some of the other changes to shared living is that there are a number of exceptions. So in situations where formerly the rule stated that you had, if the situation warranted, it had to be shared living. If you have the behavior add-on, require a wake staff 24/7, meet the complex care add-on, you may be eligible to decide you would like to use HPC in lieu of shared living. And these are all conversations that we would encourage folks to have with their county boards if they have any questions. Another change for January 2024 is that in certain situations, homemaker personal care, participant directed homemaker personal care, as well as shared living may be provided to someone while they are in an acute care hospital. These are situations that the individuals and teams and county boards and providers would need to talk about. But there is an opportunity for folks who need some intense personal care support, some behavioral support, as well as critical communication between the doctor and the patient. It's an opportunity for providers to be reimbursed for service that they'd be provided to somebody in an acute care hospital. Those conversations also all happen and are approved at the county board level. We're simply on our end processing that information so that a provider could then get paid. The other big change was the ODM rule, which allows parents of minors and spouses to become paid caregivers of homemaker personal care, participant directed homemaker personal care, as well as IO waiver nursing. And this is possible when a provider search for an individual produces no willing or able providers, and the extraordinary care instrument is completed, determining that the parent/spouse may be the paid provider. So we are in our technical assistance team continuing to support and work with providers, families, and county boards as they have questions. And as we, generally say, and I hope Corey could throw this in the chat, because I can't do two things at once, clearly, waiver policy TA@dodd.ohio.gov is our email address for any and all questions. Wanted to also mention that the IO waiver is up for renewal in July of 24, as well as we have a level 1 and a self waiver amendments also up right now for public comment. They are up through March 30th and then should hopefully go to CMS in the beginning of April so that all of these changes can take effect in July of 2024. There are 2 new services that have been proposed for the all 3 waivers. And the first one is healthcare assessment. And this is an opportunity for a 24-hour subscription service of physicians, physician's assistants, and advanced practice nurses to be available to an individual and their team to provide sort of right on time consultation when a person's direct care physician is unavailable, and help that team make some decisions about whether or not someone may or may not need to go to the emergency room. We have been participating in a pilot here, and there's been positive feedback about some of the unnecessary trips to emergency rooms that have been dissuaded by use of this healthcare assessment program. And then Keith had also already mentioned the second new service is part of both the individual employment service and as a part of the career planning job development service, and that are outcome-based payments for folks who are acquiring jobs and for the providers who are helping folks retain those jobs for 90 and 180 days. And then there's also a couple tweaks to the specialized medical equipment service so that we can assure folks are getting all of the equipment needs met in the appropriate manner. We are hoping to do similar to what we've done before, is offer some webinars and recorded sessions for county boards, providers with some of these new changes once we get a little farther along. We'll be collaborating, of course, with our community life engagement folks and our Ohio ISP folks and our, provider support folks for all of those presentations, and which will likely, of course, get some frequently asked question documents out there together so that folks will have all the information that they need when July 1st hits and be aware and available to use some of these new services. And Nyoka, I don't think I missed anything, but if I did, please, please jump in.
I don't think so. I think you covered it all. Thank you, Jolyn.
Jolyn, we do have a question in the chat. When will the residential respite rate include complex care, medical and behavioral add-on rate?
We do not currently have a plan to make any rate changes. So that would be something that we would have to put, in the works for future rate changes whenever that would come back up for consideration. So currently there is not an immediate plan to do that. So that would be something under consideration for future.
Thank you, Nyoka.
Absolutely.
Thank you, Nyoka and Gillen, for the updates. It's a lot to keep up with, and I so appreciate everything that your team is doing.
Thank you,
Busy
Meredith.
time.
Thanks.
Yes. Do we have any other questions? Or do we see any hands up? No. I'm sure there will be many questions later. And of course, thank you, Jillian and Nyoka. Corey, thank you for dropping the email address. So this is where the waiver policy team can receive questions, comments, and address your concerns. So thank you again for your time today. So I'm going to move right along to our next speaker. And we are going to get some updates from our Ohio ISP team. So I'm going to send it over to Beth Chambers.
Hello. Hi, I'm Beth Chambers, the statewide Ohio ISP manager for DODD. Thank you, Meredith, for having me. I'm always glad to join this group. I just want to take some time to go over some of the basics. Ohio ISP updates in general. The Ohio ISP is a standardized assessment and planning template and process to be used throughout the state. And just want to remind everybody, the person and their family drives that planning process. So right at the center. And then same plan format process, Ohio ISP content, that's where it's individualized. Standardized template gives you sets the stage, and then you can put the good stuff that really tells someone's story in that template. And there's an online system that will be available to teams. And one of the most important things with this new standardized way of doing things is that the plan follows the person served. So this will be much easier if people move from county to county, from facility to facility, where we're not spending time figuring out where things should go. Everyone's kind of familiar with the template, the process, and knows more of what to expect. In the Ohio ISP, it can be used for anyone. And we want to emphasize here that people receiving waiver services and people living in ICFs, intermediate care facilities, must have an Ohio ISP in the online system by June 30th of 2024. And I just want to emphasize here, we've got teams of people. We have some regional support facilitators. Oh, that's easy for me to say. You might hear them as RSFs. They're around the state in different regions, really working with county boards and those intermediate care facilities to see what trouble they might be having in transitioning to Ohio ISP. If there are any questions about the template, those kind of things, working with teams. And then if they're struggling with any of the online system issues, we do have different ways people can enter plans. They can go directly into the Salesforce system that DoDD uses. And that's where everything will end up eventually. That's where it's housed. That's the system of truth. But there are also these online or approved vendors where county boards and ICFs could use that approved vendor to enter all the required elements. They all have the same template questions, everything. It's just a different means of getting the plans transmitted to the DoDD system. So, and the reason for that is lots of other entities, county boards and ICFs use some of those vendors for some of their billing and documentation and things already. So it made sense to make that optional. So I just wanted to clarify that if people had questions. And then I wanted to go over the number of Ohio ISPs in the system. That June deadline is coming pretty quick. We did allow additional time planning. The planning process takes a while. So we know that we need plans in there, the date and the rule for people receiving waivers and people living in ICFs is June 30th, 2024. But we've worked with our compliance teams to ensure that no citations will be issued around plans being entered into the system until January 1 of 2025. So the director has sent that message out to people to say, hey, we're willing to work with you to get these plans in. So just, I know that there might be a lot of people on here wondering when to expect to see plans in the system, or what does that mean for me, my loved one. So we'll do, if you have any questions, you can go to your county board, but there is still time for people to get the process transitioned, but we really want to encourage people to do as much as they can right now. So sorry, Meredith, can you go back one slide? And then I wanted to go over the number of active, approved, or submitted status, the number of waiver plans in the system, over 1,400. So I think that's, or 14,000, I'm sorry, that's really good. And then ICFs, we've got 674, wow. And then the DC is 612. So those numbers, we're working with people. I know that the deadline is coming quick, and we are reaching out to teams, to county boards, to ICFs to really understand what their plan is. We have lots of county boards who are on their third year of doing plans in this new way. They just haven't transmitted to the system. So we're really working with that, and we have a solid idea of what people's plans are, their schedule for transmitting plans, and we're offering that ongoing support. Thank you. And then I want to talk about the Ohio ISP. We still get some feedback about, wow, this is a lot. It's long, it's kind of redundant, it's a lot, it's kind of overwhelming. So I just want to take a minute to let people know that the Ohio ISP, it is a standardized template. It includes that introduction page. And in my mind, that's how we would want to be introduced to someone. It would be how we would introduce a friend or family member. What is important to them? What are their strengths? What are they really good at? What makes a great day? And then what do I need to be aware of? So there's really important 4 things that stand out that someone would need to know right away is in that introduction page. And lots of people have been using this even when there were lots of different templates floating around. Everyone was using different ways of doing this. So that introduction page is key. And then there is the plan. And then there's the assessment. So that rich assessment drives the planning process, and the plan is the results of the assessment. And the plan is what everyone is agreeing to. They're signing off on, this is what the person wants and needs. This is what's been prioritized. And this is how, as a provider, I'm going to say that we can deliver this. Everyone's signing consent. So it really is 3 separate components: the introduction page, the plan, and the plan was driven by the assessment. So not all team members always had access to the assessment information. Now we want people to be able to access that if they need to figure out, how did we get there for the planning? And then we really want to emphasize that this is just a continuum, that there should be just ongoing casual conversation about what is working, what's not working, checking in, making sure that we're revising plans as needed, and that we're giving everyone on that team a voice. So for Ohio ISP, please reach out to your SSA or QIDP for information on what to expect, timelines for transitioning to Ohio ISP. Like I said, you can reach out to us if you need help, if you need to know what to expect. We're really looking to work with teams that are experiencing this. They're going through the process now. See what we can learn from that, see how we can better support. It's an evolution. Okay, like I said, reach out with any questions. There's great stuff on our website about, we wanted to hear from real people, real stories. So we have some spotlight videos on our website dedicated to what is working for teams. Where are they in this process? What have they learned? What's the journey been like? And it's not all sunshine and roses. Sometimes people have encountered some challenges, and how did they overcome those challenges? And what can we learn from that, and really help better support people who are entering the process now. That's all I have. Any questions?
There is one question that just came in. How can I communicate and find the Ohio ISP online?
Okay, I can send you the link for that. I can include that on how to navigate that. There's on our website, you just go to the DODD website and link on, there's a category for Ohio ISP. There are templates, there are examples, everything like that, the online version. So you can see the template. If you're talking about access questions, that might be a little trickier. You can reach out to, your son specifically. That, like I said, it depends on whether it's actually in the system. There may or may not be a plan in the system. So lots of county boards, they might have a plan in the vendor system, but it might not be transmitted. So you can certainly reach out to me. I can put my email in the chat, and we can take a look at that. You will have access to the plan. I just don't know, there's no requirement for all the plans to be in the DODD system right now. So there's different paths of navigation. So I'll be sure we can take that offline. Thank you.
And I think Amy and others who are on the call today, since we're still in the transition of people and county boards and ICFs going into the Ohio ISP system, there will be a period of time where, just like Beth said, all those plans may not be uploaded or transmitted into our system for you to access it. So if you want to, just like Beth said, reach out to her, and we can identify the county you're associated with, and if the plans have started to come in, and if we can see the plan on our side. That way we can help you get set up with the right account and the right information and the right instructions to get in, so that you can see it. But everybody is coming in at different paces and in time frames. So more to come for you all in these meetings of what to expect when those plans start, getting in. We do have, as you can see, close to just over 15,000 plans in there. So we don't want you to get in there expecting to see it. And we know that the county hasn't transmitted it yet. So thanks so much. And Beth will have, I think maybe they've already, her email is in the chat for you.
There are a few comments in the chat also. Beth, George says that a service coordinator should be able to send a copy of the ISP to a family. Judina is echoing that sentiment as well. And Amy responded, we originally were told the new Ohio ISPs would be available to see online. So that's some good feedback, Amy. Yeah. Thank you for sharing that. And thank you, Stacy, for sharing the information as well.
Yeah. And Amy is really quick. Amy is correct in her comment, but again, I just want to reiterate that as county boards and ICFs are transitioning into the Ohio ISP, The transmission date is the end of June. And then we are going to be giving them some additional months to get all the plans loaded. So Amy, what you've been told is, yes, you'll be able to log into the state of Ohio system and access your plan. But because we are just in the implementation of getting county boards and ICFs like changing their processes and their practices and their conversations and their outreach, they're doing the plans. Then after they actually get the plans finalized, then they'll be loaded. So that we are going to have a point in time where you may have seen an Ohio ISP or had the meeting and you've got it that you've got from your county board. It just may not be transmitted into that system, but there is still that target and the goal that they're all transmitted in there and that you can get it and you can see it. We can get you guys access to the OHID system, but what might happen is you're going to log in and there will be no plan because that plan hasn't been transmitted yet, but it doesn't mean that they don't have an Ohio ISP. So because we're in that transition, you're just going to see some are loaded and some not. So that's why right now, if you can just contact us individually, we can let you know, because we know mostly each county's status and ICF status is in the work. So the goal is still there, Amy. It's just where plans are getting written, plans are getting signed and developed, and then they'll get transmitted. So more to come so that you all can have access to plans.
Thank you, Stacy. It's helpful to have that clarification. So I appreciate it. I know families are definitely curious about this. So thank you. So I'd like to move right along to our next section so that you guys have some time to connect with our leadership team. So we will give a few updates from the Ohio LifeCourse Nexus team, things affecting and supporting families. So much like this space that's designed for people living with for families and family serving organizations. My colleague, Nathan Turner, he hosts Disability Connect, and that's a gathering for people we support to share and learn about issues affecting their lives. So that meeting will be hosted in April 17th, and it will be hosted virtually as well. So I'm excited about that. Thank you, Nathan, for leading that space for us. And I'm really excited that Nathan and I will be hosting an in-person gathering in June of 2024. So typically these meetings are virtual as they are right now. And I believe since 2019, that it will be the first time that we gather in person. So there's going to be some exciting things. Registration will come soon, but make sure your calendars are open for June, so we will have some time to connect. And the best way to get information in between our meetings is to subscribe to our newsletters. There's newsletters on just about every topic for families, for direct service professionals, early intervention, and overall updates. So please subscribe to that. And again, Nathan Turner hosts our DODD podcast. So he always has some great interviews and folks that he speaks with. So I'd like to pass it along to our leadership, Director Hauck. And again, I would like to remind folks that this is a time for everybody to have an opportunity to ask them general questions. If there is a specific question or concern about your personal situation, we are happy to address your concerns offline, and your questions and comments are important to us. So I will pass it along to Director Hauck.
I think I'm unmuted. Can everybody hear me? Good afternoon. I'm happy to be here with everyone. I know that Meredith sent me a couple of topics that you wanted to chat about. So I understand that you might have some questions around parents of minor children being paid providers. We have posted quite a bit of information and guidance around this topic, and we actually will be releasing additional guidance, I think next week, around the reporting of MUIs and behavior support and some of those sorts of rules and regulations that come into play when you're being a paid provider. So I thought I would just ask if there are specific questions that you'd like me to address, or if you just want to hear in general. And Corey or Meredith, there is the information is on our website under the Appendix K flexibilities. If you would like to post a link, that's where our current guidance is living right now.
Thank you. I will let Corey find that. I believe he's shared it earlier, but I am not tech savvy enough to to do two things at once. But yes, thank you for sharing about the parents of minor children as providers. If anybody has questions about that, this is a great opportunity.
So I'll just share that if you are a parent and going to be a paid provider, you do have to work for an agency. So I think one of the questions was around, will we support the financial cost of becoming a provider? And honestly, I'm not sure what those financial costs would be since you'd be working for an agency, but certainly if there are some or that I'm not thinking about, please, let us know.
There is a question in the chat, Director.
Okay.
Will there be more guidance about willing and able for provider search for parents of minor children?
So again, I think we just put something out about willing and able, but I will look for that and make sure that you have that. And specifically around provider search, do you mean the having to search for a provider prior to being approved?
Kate, do you want to unmute and maybe clarify your question?
Yes. Hi, Director. This is Kate Schwartz from Northwest Ohio. So I hear a lot of pushback about the willing and able, about agencies that say that they're willing and able to have someone, but then they still have to hire staff. And it seems to be a disconnect between the willing and able and having the expert, who is the parent, be the provider. So there's some discussion and discontent around that. And so I'm curious if there is some more feedback, if there's an appeals process potentially coming. It feels frustrating that it feels like it's the families kind of pitted against the DV system. And so I think it just needs some more in-depth conversation about it. And also, the fact that I'm thankful that there's a level of care and an extraordinary care tool, but I think parents are frustrated, obviously. So, and that's the feedback that I'm getting on a personal level. So I'm just trying to elevate their voices. So thanks for your feedback.
Thank you. And I'm sorry to hear that, that's how families are feeling. We certainly don't want that. And let's see, I think you asked several questions. So let me see. The willing and able piece certainly should be talked about during your team meetings and as part of that process. And certainly, working through that as a team. And if you can't, I heard something about an appeal process. If you can't, please reach out to, if the team isn't coming to resolution, please reach out to us. While there isn't a formal appeal process right now, certainly our Medicaid team here at the department has looked into, a couple of situations that we are aware of, and provided the county with the guidance needed. And we think all of those have been resolved. So certainly if you know of parents that haven't gotten closure or their situations resolved, let us know, and we will certainly work through that with the county.
Thank you for that. I appreciate it. We do have some other questions here. Terry is asking, what training does the staff or SSAs have to help families navigate the system and know the steps to take to become providers?
Sure. So the Ohio Department of Medicaid developed some modules or trainings specifically for SSAs. And so those are all, I believe, on ODM's website. If you'd like to know, I can find out for sure. And we have sent out communication directly to county board superintendents, as well as in our memo Mondays and other communications, to ensure that they know about them. They are required to watch them and participate in the trainings. We've also had our Medicaid team attend SSA forums and other ways that we traditionally communicate with our SSAs to talk through the process. And Nayoka, I just saw that your eyes. Was there anything else that I missed as far as the trainings go?
Someone mentioned too that oftentimes the county boards, many of the county boards have provider relation areas that will help people get through the new provider processes. We also have office hours. Our certification department has office hours that will help if the issue is around, those areas. I think Ann Weisson's on, I think her area also has done some things. We have many resources on our website about, becoming a provider as well. So we've definitely developed lots of resources that are on our website. So again, if you reach out to us, we can connect with lots of information. So
thank you.
Yeah, Nayoka is right. Each of our 88 county boards does have someone identified within the county board who works in a role of provider support. And generally that includes the provider application process as well. So we do encourage you to reach out locally first. But as Nayoka and others said, we have also here at the department lots of resources. So if you're not getting resolution at that local level or there are additional questions, please feel free to reach out.
So a few comments. I do see that there are comments about different counties. Thank you, Ann, for sharing the structure of how all of the SSAs are getting supported and providers. So a comment is that there's SSAs who need more guidance. So it is helpful to hear from you.
And it's obviously it's a new process, right? The rule just was January. And the thing that we don't want any gap in services. So if you happen to be providing services during the pandemic, there's that window where you could continue to provide the transition. I couldn't think of the word I wanted to use, the transition window. So again, reach out to Nayoka's team if there are any issues with that. There are new billing codes and that sort of thing that I'll call out that, we're hopeful that people will transition to use. So then we can, have more data and information to help as we move forward with this new service.
That's great. It's going to be so helpful. And I love hearing all of the collaborations happening across the state and all of the support teams. So thank you, everybody, for those. And were there some other questions that you wanted to address also, Director Hauck?
Well, the other thing that I think you mentioned, Meredith, in your email was about the assessment tool, so the DDP. As I'm sure you all have talked about on this call and other forums, we are working on a waiver modernization project that we've been doing for a little bit now. And actually the service about paid caregivers, we talked about that, and shared living, remote support, some other things. But the where we're at right now in the process is looking at assessment. And so we are looking at the DDP. As I traveled the state last year and talked with many of you in person, I heard a lot that the DDP wasn't really meeting the needs of people served and their families. So, we're taking a look at that. We're looking at some standardized tools with our partners at Deloitte. We've engaged with the county boards to really look at how they use assessments and what those look like. And so we'll be continuing doing some of that, investigating and research. Once we have a recommendation from our county boards, we will hold some informational webinars. And we'll meet with providers and families and people served once you get to look at the tool, and we'll get feedback on, are there gaps on the tool? Do you think we need to have additional questions added? Some things like that. Again, I don't think at this point we plan on building a tool. So we really do plan on looking at something that's standardized. So the questions themselves won't be able to be, I use the word tweaked or changed, but certainly if we identify gaps, we can address those. And you'll get information as soon as we have it on that, what that looks like. No decisions have been made yet. So I don't really have anything to report as far as what tool or what we're looking, I think we've just been looking at various tools that other states are currently using.
Thank you for that update. That is very helpful. And I believe that most communications and updates come in our Memo Monday and other sources as well. So I encourage folks to subscribe to our newsletters. That's where the most up-to-date information is shared. So there is another question that I'll read. Is there any chance that county boards will have a training on Ohio Rise? What Ohio Rise entails and what it can and cannot provide to families? Is there any training for the public on the intersection of both programs?
Thank you, Kate. I don't know if there is any current or different training about Ohio Rise that's out there right now than what they provided in the very beginning and when it started. But certainly I feel certain that somebody from ODM would be happy to speak with this group or speak with the county boards. Ohio Rise is, again, new. It's in its infancy. It's, I think, a couple years old now. And really, I look at it as a funding source and a way to help gain access to services that are needed. If you are not on a waiver, one of our developmentally disabled waivers, so our DD waivers. I see Corey put a link. So yeah, again, Meredith, if you'd like us to contact somebody at ODM to speak to this group or another group, I'm sure they'd be happy to do that. Or Naika, I don't know if there's additional training that's been, I don't think anything new.
I know. Yeah, I was going to say, I feel like it hasn't been that long ago that the entity that has a contract for their care manager, Nick Miller came and spoke to the SSA directors. But certainly I think we could arrange for someone that represented, to come do that again. I'm sure I could make that contact and ask for that again.
So
you.
with a managed care company rather than like ODM.
Well, I mean, we
Yeah,
could.
either one would work.
Yes. I mean, he spoke about the program, what they cover, that kind of thing. But yes, we could certainly request someone to do that.
Yeah, thanks.
Yeah, thank you for the collaboration. Thank you for the question, Kate. I would be happy to invite somebody to share and give us updates on that. And we also have our multi-system youth group that I could invite to share about some of the work that they do as well in that space to support people across Ohio. So we have
Amy, you're right. You're absolutely right. With your comment in the chat that it's not meant for immediate emergency crisis. But like Meredith just said, we do have our multi-system, our MSY, our multi-system youth team here at DODD, at JFS, at the Department of Children, Youth, Medicaid. I'm sure I'm missing an agency that those teams do get together regularly to talk about those crisis situations and what can the state do to help. But obviously your best place to start is local. Family and Children First, your DD board, your MH Adams boards, those are the folks that are there on the front line to help.
Thank you. Do we have other questions or comments, or are there other updates that Director Hauck or any of our other leaders want to share that maybe have come up?
Don't have any additional items to share on my end. I know the team's here today. Appreciate the time to come meet with all of you to give updates and be available for your questions. So no, we're here to answer questions, and you've got all of our emails in the chat if there's direct outreach you'd like to do after today.
Yeah, and if you all could, today or sometime touch base with Meredith about what are the important things that you would like to hear about, or challenges that you're facing locally, let us know so we can make sure to address those in future meetings or offline. That'd be great. But thanks, everyone.
Yes, thank you. Thank you to everybody who took time out of their very busy schedules to participate, to join, to ask questions. I'm really excited for our opportunity to gather in person in Columbus on June 12th. As the director mentioned, and Stacy and everybody else, we are here to answer questions, and there will be some opportunities in June for folks to give feedback, and we're really excited about that time. So stay tuned for final details and links and registration to come. So I appreciate everybody very much, and have a wonderful afternoon.